Well, welcome. We continue the silly season where we're trying to really have informed opinions. Anybody of the 6 loyal viewers who watch the show will know I promise, and I've held a promise, I'll never ask you to vote for any specific candidate, but I'll beg you to vote. Get out, learn what each candidate stands for, what they're all about, what they believe in, so that you can have an informed opinion. Tonight, we have a newcomer to our area of politics here in Milford. Why don't we start with an introduction?
Hi, I'm Tom Morali. I'm the Assistant Treasurer and Economic Development Chair in Mendon, and I'm running for State Senate. So yeah, it's good to be here.
So Tom, we'll start with the question. I'll put you on the spot right away that I always start with. Tom, I'm from Milford. Why should I vote for you?
Well, I'm a lifelong resident of this district, right over, I guess, a couple borders in Mendon. I've been around Milford my whole life. I actually worked in the Milford-Hannaford for several years, so I really know this town. And I know what all the towns in this area need working in municipal government. And that's a big part of my campaign, is actually bringing the focus of municipal issues to the forefront of state politics. Because we live in such a unique state, or commonwealth rather, where we have 351 local governments, I think that a lot of the time the burden gets shifted from the state onto the local level. And I really want to change that.
Where do you see you having the biggest impact on Milford?
On Milford, well, I think the biggest way I can make an impact for this town specifically is, I think, being a fierce advocate for grants in the form of infrastructure and other areas that simply aren't finding their way to the district in the way they have in the past. So really, I think that my knowledge of municipal government can help in that area.
So now you're going to represent 13 different towns if you become our senator. Very different towns.
Absolutely. How
do you balance the needs of each of them?
Well, I think it's a matter of getting out and talking to them. I think it's getting to know the officials, creating relationships with them, talking to all the town boards. Every town has specific needs. I know I was talking to Mendon's town administrator not too long ago before the show, and she was saying how the biggest issue in Mendon for growth is the fact that we don't have town water at the moment, which is obviously a very different issue than Milford has. So it's a matter of knowing what each town's individual needs are and keeping that in mind when you're up on Beacon Hill and these votes are coming across and grants are getting created, keeping in mind what each individual town needs and being a fierce advocate for them.
Now, we've been a bit unique in Milford in our fiscal approach. We always joke that we don't allow profanity in our budget meetings. So words like 2.5 override and debt exclusion.
Right.
How do you feel about using 2.5 and debt exclusion?
Well, I think the idea is to prevent the need for them on the town level by making sure the state steps up their role. When you really force the burden, especially in the areas of school budgets, onto these towns, you're going to see endless overrides and really unfairly shifting this onto the local taxpayers. So I think a good state senator would really fiercely advocate for aid in the way that wouldn't need to happen.
Now, I like that idea because we've seen so many unfunded mandates come our way.
Right.
On special needs and ELL.
Right.
What have you seen across the district? How are towns dealing with it?
I've seen that happen quite a bit. We simply aren't paying for the needs of our school districts and special needs and other areas. And I think there are a lot of, exactly what you said, unfunded mandates. And I think the issue is that we have a Chapter 70 system that's been in place since 1993, and it needs fixing. In fact, there was a commission called a couple of years ago to review the Chapter 70 budget, and they found that the way that they calculate it actually greatly...
All the money goes to the big cities?
Well, all the money goes to the big cities, but also the fact is that in calculating what a school district needs, they don't even anticipate the amount of special needs kids that are in any given school district. They greatly undervalue the cost of health insurance, and they greatly undervalue the cost of transportation. So in areas where things might be more spaced out, like a lot of the towns in this district, that's literally, forcing an undue burden on them.
Well, we've seen it because years ago, we had to shift how the school committee budget is presented and funded. Because with SPED and ELL, how do you control that?
Well, it's a matter of really, on the state level, actually anticipating the high population that special needs students often make up, which it doesn't do right now. So we really need to create a budget for the 21st century, or an approach for the 21st century.
I saw last year we funded our schools with a 2.4, a reasonable increase on inflation, less than 2%. But we had to kick in an extra $600,000 to take care of extra SPED and ELL.
Right. And then on top of that, you have the transportation costs of some school districts not being able to not actually having the resources to handle a lot of the special needs. So that adds an even crazier cost on top of all of this.
But now, if you take and you say, you're going to increase Chapter 70, where do you get the money?
Well, there is one way we could fund this very easily, and that's actually on the ballot. It's called the Fair Share Amendment. And actually, it's earmarked for infrastructure and education. And if that passed, we could fund a reasonable increase to the Chapter 70 budget.
But what does that mean, fair share?
Well, it's a millionaire's tax. And it's a tax on the millionaires of this state, asking them to kick in a slight percentage more. And I think it's worth it, because I think that education is the greatest resource that Massachusetts has. And I think that it is one of the best things we have going for us here in this state. I think it's something that I think is very reasonable to ask for.
But that would be a tax only on people making more than $1 million a year?
$1 million a year, yes.
And how do you define that? I mean, why $1 million? Why not $500,000 or $250,000? Or?
Well, I think it's looking at the fact that the infrastructure of the state, and every state really often, the infrastructure often benefits those with a lot more money more. For instance, if you own a large company, you use the highways a lot more to transport your goods all over the state. So obviously, we'd ask you to kick in a bit more. And once, like I said, we do have a pretty reasonably high population of wealthier people in this state. I think one of the reasons for that is the fact that we do have such a good education system.
Oh, I agree with you. I can't imagine there's a better investment. One, in our families.
Absolutely.
But in the Commonwealth in general. I mean, thank God we got the universities we do, because look where all the talent's coming from. It's all these university companies that were kicked out and started up.
Right.
I just always have a dilemma in my mind trying to rationalize, where do you draw the line? I want to tax more people. Okay? And it seems like as long as it's not me, it's somebody else.
Well, I think it's the cost we have for living in the great state we do. And I think we do have a great state, and I think that it can be better. So that's the way I look at it.
Are there areas that we could divert funding rather than increase taxes?
Well, I think that, there are areas we could divert funding from. For example, I think that we give a lot of tax money to health insurance companies every year in this state. And I think that's one thing that we need to look at, is when we're giving all this money to for-profit entities. I think that we have to, when we're looking at the, health insurance for our school employees, I think that we have to look at that.
Well, that's a killer every year. I mean, we fund that here in Milford separately.
Right.
Because, it absolutely annoys me when I hear how lucky we are that it's only going up 8% this year.
Right. And actually, when they looked at the Chapter 70 budget, one one of the recommendations they had was putting inflation for health insurance on a separate plane, because you can't look at that the same way you can all the other parts of the budget.
But again, why not? I mean, why should we feel good, Tom, that medical costs only went up 4 times inflation? Somehow it just doesn't feel right to me.
Right. Well, I agree with that. In fact, we are the highest cost state when it comes to healthcare. This kind of leads into another big part of my platform. I strongly advocate for moving towards a single payer system in this state. And when you look at the cost for, not only school employees' health insurance, but for town employees' health insurance, the cost that small business owners have to put up to pay for their employees' health insurance, you're talking about a lot of money that not only kills local budgets, but also kills entrepreneurship. And so I think that really taking a look at how our healthcare system is set up would help solve a lot of these problems, not only on the town and school levels, but also when it comes to small business as well.
Yeah, and the whole single-payer concept. I mean, I lived under socialized medicine when we were living in Paris. I thought it was the greatest thing in the world because we had Blue Cross. So all of my wife's friends were waiting for services and not getting what they wanted. And as long as we had private insurance, we got whatever we wanted as soon as we wanted. So it worries me that if we have a single-payer system, will the people who can afford supplemental insurance get more than the rest of us, or how do you make it equal? I
often hear this idea that people wait forever in lines in countries that have single payer. But I know that when I go to the hospital here or the doctor's office, I have to wait in line almost just as long. And we're seeing ever increasing lines as well because people are going to the hospital for more preventable things. So it's really a matter of making sure that everybody gets the care they need for very preventable things when they first become an issue.
But can anybody argue against, I mean, I hear this thing that we're not going to provide health care, and I laugh. I mean, you show up sick in an emergency room, you're never going to get turned away.
Right, but who pays for that?
Well, we all have to. It's the cost of being part of a community.
Right, exactly. And my answer to that is, well, then why don't we take care of the problem before it becomes as big a problem?
Well, see, there I agree, and I like this idea of when I get a cold, I go to the doctor. I don't wait till it gets pneumonia because then all of a sudden the costs are an order of magnitude higher. But, you know, along the lines you said, we're paying an awful lot to a lot of for-profit companies.
Right.
I'd love to see a way of making it more efficient so we don't have to pay as much. But I don't know how to get there.
Well, that's the thing. There's actually a review of single-payer health care, like the cost that it would save on the state level. And economists from UMass Amherst actually testified before the legislature and said that for the average person, it could save up to 19%.
Well, what do we pay? About 20 grand a year for family health? That's pretty significant savings if you start multiplying how many people times 8 grand a piece.
Right. And also on top of that, you look, like I mentioned before, employee health insurance for local towns. It would save about $350 million per year. That's $1 million per town. And I know just about every town around here could use $1 million myself. But
we all could use money.
Yeah, absolutely.
Now, we talk about health care. One of the big things, and it's hit Milford hard, but from what I read, it's hit everybody hard, is the whole opioid. I don't want to call it a pandemic or an epidemic, or, you know, but it's a real problem for all these towns. What can we do?
Well, I just want to start off by saying I think that Milford has taken a very proactive approach to dealing with it, with the whole creation of the task force. And I think that's shown, but as always, there needs to be more done. I think one of the problems is that health insurance doesn't recognize this as a disease, and we're not getting people the treatment that they need. There's studies that show that the 60-day treatment, which is kind of the gold standard right now, is not very effective. That there needs to be 90-day treatment, because what these things incorporate, they incorporate job training and social training as well to get people's lives back on track. Because otherwise what you're doing is getting someone all dressed up with no place to go, really.
But doesn't it start with the stigma? I mean, when I grew up, and I'm much older than you, when you thought of a heroin addict, pictures of a back alley in the dark side of Boston and a sleazy person, you know, with a needle, was what we grew up thinking a heroin addict is. Today, for the love of God, it could be my neighbor's kid.
Well, that's the thing, is it affects everyone. I know every morning before I log on Facebook, I just wonder, is it going to be a friend or a friend of a friend or a family member who I might see today with a rest in peace next to them? It's just terrible, and something needs to be done.
But what do we do? I mean, I think we all agree, world peace, yes.
Right.
You know,
right.
we want to solve the opioid problem. Okay.
Right.
What do you do?
Well, like I said, one of the things is actually getting people the treatment they need. As I mentioned before, the 90-day approach. Getting health insurance to recognize this as a disease. Because right now, under something like Mass Health, you know, you basically just get a weekend of detox.
Wait a minute, you're a heroin or an oxy addict, they put you away for a couple of days and say you're all fixed?
Yeah, and
how does that work?
I mean, it doesn't. That's one of the problems. And the other thing too is even finding a place to stay. There aren't many inpatient facilities out here, and oftentimes you have to wait for a bed to open up in Boston. So that's another problem. And on top of that, you have this entire medical aspect to it, where for years, I think you've seen people over-prescribing medication. And I think we're starting to recognize that. And the question is, where do you draw the line? Where do you draw the line between, you know, being very cognizant to pain, but also recognizing that this has actually made this epidemic a lot worse?
We had our rep come on, young Joe Kennedy, and he mentioned a situation where he was prescribed oxy, and he tried telling the physician, I don't need that many. If I take any at all, it will be a lot less than you're prescribing. And the physician, I wouldn't say argued, but the way he put it, the physician took issue with the fact he didn't want them all. I mean, how does that make any sense?
That's the thing, though. And when you're told this will help your pain, and when someone is in a great deal of pain, I can absolutely see where it would be easy for someone to get hooked. And what we need to do is give doctors the confidence to try alternative treatments to large amounts of oxy and opioids. Because what we've done in a large way is make this problem worse. And I think we're starting to realize that. I know that one pharmaceutical executive actually went to jail recently for offering kickbacks to doctors that prescribed his drugs. So this is a problem that in large part was started by the pharmaceutical industry. And, you know, I think that we need to bring the healthcare industry in to fix the problem they helped start.
Unfortunately, that seems obvious. You know, that realistically dealing with our kids, our neighbors, our friends who are now, and I mean, I could see it. Oxy, I think our chief of police, Tom O'Laughlin, came on and said, or was it Sheriff Lou? One of the two told me, it's $1 a mig on the street for Oxy. So each tablet's like 81 bucks. How could anybody afford 3 tablets a day to maintain a baseline? No wonder they fall to heroin and something cheaper.
Right. I mean, that's the thing. When you're addicted to something, you're going to find the next best thing or the cheaper thing.
Well, I mean, it doesn't seem like you got much choice. I mean, thank God I haven't, except for alkaloids, I'll admit I'm addicted to. I need my coffee.
Yeah.
I'll admit.
Yeah. I probably am in a similar boat.
You know, so if you talk about alkaloids, okay, I'm there. But I can't imagine you're very effective if you're maintaining, you know, some kind of baseline of opioid level. So how do you make enough money?
Well, that's the thing. I think there's a lot of people who are very effective for a number of years, and then eventually it just catches up with them. I mean,
Wow.
it affects every single walk of life. I think that's something we've seen.
So your idea would be funding? What would you
Well,
put in?
it's not just funding. It's the types of treatments. We need to use evidence-based treatments. Like I said, a large part of this is, when someone gets over the actual physical part of the addiction and goes through detox, they really are like, okay, what do I do now? When you've been in this spiral of addiction for so long, you have to get the job skills back. You have to have someone who's there to teach you really how to get up for work again in the morning and get to a job on time. And
I can see it, because then if somebody says, why'd you take a year off? Well, I was a heroin addict and I really couldn't work well.
It doesn't really go over
I mean,
well.
I don't think it's something you put on your resume.
It's a real problem for a lot of people who are trying to re-enter the workforce.
Now, you mentioned a little while ago water being an issue for at least one of the towns in your district. I don't know that we don't have a water problem.
Well, I know there's that huge issue with the Milford Water Company a few years back. And I know that many towns in this district have problems with their water. And a lot of it comes down to not having the resources to actually fulfill the regulations as they come down for the EPA and other state organizations.
And we'll talk about the phosphorus regulation, but the issue I've had with the water is I'm totally confused. Our water company, I don't know if you're familiar, told the town that they could have plenty of water for this casino that was coming in.
Right.
Which would be another 20-25% draw on our water. Yet, okay, we're in early part of the year. By February, March, you usually see signs up on Silver Hill Road that says, don't water your lawn.
Absolutely.
Now, who would be watering their lawn in the middle of a snowstorm? I've never figured out.
Right.
But it seems like half or every other year, we go through water sanctions because we don't have enough. So to me, Milford does have a water problem. I just can't figure out
exactly how to fix it.
I
think that's one of the issues where there are a lot of grants available for infrastructure in this state. And you can go to the MassWorks website and see them being given out to towns all over the state. But one of the areas they rarely go is down here.
Why?
I think that it is a good question. I mean, I think it's really about getting better representation on Beacon Hill when it comes to the Senate. But it's really about aggressively pushing for our towns and making the case as to why we need these grants. And if you want to make an expanded water system, I think that there is money available at the state level for that. It's just making sure it comes to the right place.
I think I'll ask that question at the next FinCom meeting as to, if there's money out there,
why aren't we getting it?
Why aren't we going after it?
Right. Well, and a lot of it is, if you look at the state system of grants, this is something I hear from a lot of town administrators. It's very confusing to navigate, and it'd be very helpful for someone to actually have these ideas in their head, like this is what my town needs, and bring them forward to town administrators or a FinCom or a DPW saying, hey, look, this money is available, you should apply for this. Because by the time you figure out it's there, somebody's already
taken it.
Exactly.
But I mean, this seems so basic. Water.
No, it does.
More.
It does. It does.
What do we have to say? What would you like to do with your water? More. Cleaner.
More
okay?
cleaner.
I mean, there's only 2 or 3 words you can say and the message comes across.
You'd think that, but I mean, based on my conversations, it doesn't seem to be the case for a lot of these towns.
Now, you mentioned a millionaire's tax to fund some of the
infrastructure.
What kind of infrastructure?
Right. I think it's a matter of roads, water sources, bridges, electricity, that type of, just your basic bread and butter, how you get around, what your town provides, that type of infrastructure. I know in Hopedale, they're trying to really invest in the rail down there. I think that it could go towards doing that, because that would be a shot of adrenaline for this region, I think, economically, if that project was completed.
But now realistically, we would all benefit from infrastructure.
Absolutely.
Shouldn't we take some of the money we all spend and put it towards infrastructure?
Well, I think we do, but I think it's being targeted in the wrong spots.
Okay, help me understand.
Well, essentially, towns get Chapter 90 funding.
Right, the highway funding.
The highway funding. And the state kicks in some aid for that. And the towns kind of come up with the rest. But I think that just based on my conversations, it's just not enough.
Well, it's never been enough. I think on average we kick in an extra $500,000 to $1 million out of our operating funds every year. Otherwise, Scotty, our highway director, would be able to do, this much of one piece of one road.
Right.
You get $500,000 or $2 million, sounds like an enormous amount of money till you figure out what it costs you per mile of road.
Right. And that's really the thing, is just how do they expect us to have a more connected Commonwealth with really putting up that much money for these towns. So a lot of them have to really continue to increase property taxes on people that are already financially strained to pay for it.
And I've actually felt pretty good. The average house in Milford's around $4,900, which to me is still too much. But, for the services we get, it doesn't seem crazy. But again, you look and say, how do you control that except spending? We can tax, but eventually, you run out of, people to tax.
Well, and here's the big part of it. Closer to the city, you have more of the state services that are available to everybody's use, and a lot of those towns really get to kick in less for their services, who are richer. But out here, we have to provide for a lot more, provide for a lot more services on the local level, and that inevitably leads to higher property taxes. And especially, in the western part of this district, you see that happen, where people are getting priced out of their homes they've lived in for several decades.
Well, we have that argument at least the last 10 years, where, we've been fortunate. We've got great department heads that really work with us. So we typically have been averaging 2.8 million surplus on the low side. We've had years of 5.8, but that was an anomaly. But when you start looking at the arguments that happen, people will say, well, you ought to spend it. And then you got people like me saying, it's not my money. I ought to give it back. Right. Because, too many of our people, the people who built Milford, are living on fixed income. How the heck they survive on $1,400, $1,500 a month to begin with, I don't know. But giving back, like last year we gave $1.8 million back to the tax rate. And to me, it's not giving it back. We just took too much.
Well, and that's one of the things, is property taxes are inherently regressive in a lot of situations. What you'll see is people who aren't making, a large income, who still have to pay a large amount of that limited money they have. And I think that's why it's wrong to shift this burden so much onto the local towns.
But where do you put it? Charlie Baker said he would not let expenses go up, and he seems to be holding spending at some kind of level. But you're going to convince him to take money out of the big cities and push it back to us?
I think you need an advocate or several advocates in Beacon Hill who are pushing for that, because really, there is a part of the state west of the Boston area you know, and
And yeah, we have to convince some of them that you don't need a passport when you cross 128.
right, yeah, it's really, we're here, you know.
Well, they remember us when they want tax money.
Oh, exactly, and you know, when comes time for statewide election as well, you know, but they need to remember us in the off years as well, and really invest in these communities, because especially as the knowledge corridor expands and people are looking to Worcester for economic development, a lot of people are going to be wanting to get to those jobs. And the best way to do that is to invest in our infrastructure.
Now, interestingly enough, you talk about investing. Where do you see us being able to invest to help the local economy?
Well, I mentioned infrastructure is a huge one. Another place is public transit. We live largely in a public transportation desert.
I was going to say, we have a bus in Milford that we're trying.
Right.
I don't know of many towns around us that have a bus.
I don't think there are.
We
any.
have one.
Right, and that's the thing. What good is it to create these high-tech jobs if people can't get to them? If you aren't going to make it easily accessible? When all the jobs are in the city, when all the jobs are in areas not that close to here, I think you really need a reliable public transportation system. And, you know, a bus is good, but...
I mean, we got one bus and it's costing us $250,000 a year, and I think we're averaging, it's about 40, or now it's down to $25 a ride.
But when you expand that bus route, inevitably more people are paying into it and the cost goes down for everybody. I mean, it's just, it's literally just, you know, how much more would it cost for a bus to travel into, say, Hopedale or Mendon? You know, it really...
No, but I agree, but you turn around and say, is Hopedale, Mendon able or willing to pay for that?
No, I think they are. When I talk to people, I think people are looking for it. I know one of the big issues in Mendon is that we don't have a bus stop, when I've talked to several people. So I think really that there is a hunger for it.
Well, we're having this debate, not should we have public transportation, because a lot of the people in Milford don't have cars, can't afford cars.
Right.
So having a bus really helps. Our special needs kids, they don't have the ability, some of them, to drive themselves around to get to jobs. So, you know, we've been told over and over, it's a lifesaver that they can get on a bus, go to their job independently.
Right. Absolutely. It changes the whole ball game.
Changing ball games, the economy. Your feelings on where we are and where we're going?
Well, I think the economy, you know, if you look at the stock market, it's doing very good. You look at job creation, it's up. But really, you have to look at what those jobs are. How much are they paying? I think what you have is a lot of people working a lot of different part-time jobs in a lot of cases, and jobs often without benefits, jobs that aren't high-wage jobs, and really, we're looking at a gig economy.
You think so?
Yeah, I think so. I think based on the fact that wages have stayed stagnant, and you know, you get a few hours at one job and a few hours at another, and neither of those jobs who qualify for benefits. It's really a situation you're seeing more and more.
Because, you know, when we talk about jobs in this part of the state, the Metro West area, everybody talks about biotech, high tech, and those aren't your low-paying jobs. Right. Nobody talks about other jobs.
Well, I mean, I know there's a couple places in Milford, but I know in the other parts of the district, you aren't seeing the similar high-tech jobs. And that's one of the things. We have BVT, we have this great vocational school. And it's supposed to come with the promise of a lot of these higher tech jobs being created in the area. And when you don't have the infrastructure to bring those jobs in, then you really inevitably go to other places. And that's another thing I want to talk about is SHOP in vocational school. You have a lot of employers who are looking for people for high-skilled positions that simply can't find the people to fit those skills. And I think what's happened is we've taken a lot of the trades out of schools, and we've made the barrier to access to places like BVT higher, so that you have a lot of people that don't have the opportunity to, instead of going on to college, going into a skilled trade program.
Well, that's one thing that's always been near and dear to my heart, because when I grew up here in Milford, if you were going to college, you went to Milford High. If you were going to be a craftsman, you went to BVT. And, I think and it hits home when I think of people like my father. Put my father in an organic chemistry class, he would not do well. He wasn't an academician. Came from Portugal with 4 years of school, because that's what they got.
Right.
But give him a tool, and the man was an artist. He could do things with tools that just baffled me. So I worry today, if I'm a kid in Milford, and I'm a good kid, I'm intelligent, but I'm not academically inclined, I can't get into BVT. I got to be top 10% of my class.
Right. And
Milford High is forbidden from having programs that compete with carpentry and plumbing. How do you take care of these kids?
Well, I think we have to choose, what kind of schools these schools are, A. B, I think it is about bringing these classes back into a greater array of public schools than just these few vocational schools that are around the state.
And don't get me wrong, what Dr. Fitzpatrick has done with BVT is amazing.
Absolutely.
But you got to be in the top, maybe it's 20% of the class. You better not have any behavioral issues. You get to cherry pick, which is great, because we're all proud of what comes out of BVT.
Right.
But again, I get scared for the kids who are good kids, smart kids, just not, what do we call it, book smart? How do we take care of them? Because there's a need.
Absolutely. And like I said, I think that really, if we're going to get serious about, I guess you could say, fixing the job market, that's really what we have to look at.
Now, you mentioned you don't see wages increasing. I mean, I keep reading that this company or Walmart now is going to increase wages, and maybe not to the $15 an hour, but I mean, when I look at Dunkin' Donuts and I see signs starting at 10 or 11, aren't the wages moving up a little? Or?
Well, I think you also have to look at, are they hiring these people for less hours? Are they laying off jobs at the same time? It's really a matter of, we need to give people careers. And that's not what we're creating right now. We're not creating careers for people. We're giving people gigs, like I said before.
But how does that help us as a state if you're not creating careers? I mean, you're going to have people that are on the dole all the time? I mean, how do these people make a living?
Well, I think they're living paycheck to paycheck, and I know when I, as I said before, I used
Tom, I'm married with children. That means I have no money either, but maybe not that bad. But
I mean, that was the thing. When I used to work, like I said, at Hannaford, and it was the type of thing where sometimes I'd work till 9 or 10 at night and go back in for 6 in the morning, because those are just the shifts available. And I think that's the case for a lot of people in this state.
Will this tax bill help?
I mean, I don't think it's going to help your average person all that much. I think that also, on top of that, you're going to see automatic Medicare cuts next year. So I think that's going to hurt a lot more people.
Automatic Medicare cuts.
Right. There's a trigger built into the bill for if the economy didn't grow to a certain point, that this Medicare cuts were going to come into play, and Medicaid cuts as well.
If you cut Medicaid, who does that really hurt? Are the physicians going to charge less? I mean, how does that work?
Well, it's going to be a lot more people going to the hospital without being able to pay for it. And then that, once again...
Well, then we pay for it anyway.
Right.
I mean, you know, to me, there was fiction saying that these people go to the hospital and nobody pays for it. We're going to pay for it one way or another.
Right.
Somebody has to, because you're not going to turn away sick kids and sick people.
Yeah, and as I said before, it's better and less expensive to treat that stuff up front. But on top of that, I'm sorry to interrupt, but on top of that, it's the right thing to do. Well, absolutely, yeah.
I mean, how can you say, well, no, we're going to let that little girl get real sick before we deal with her? Who do you know that would have that attitude?
Well, I don't personally know anybody, but there's apparently some people in Washington who have that attitude. So that's what we're dealing with.
Now, one of the things I noticed you talked about was dying with dignity.
Right.
What did you mean?
I think that when you have people near the end of their life.
I'm old, I'm near. Well, closer.
When you have people who are in a situation where they really are no longer them. Mm-hmm. They're on their hospital bed, and I really did, I don't want to get too graphic, but I think that there should be a decision to be made between a patient, a doctor, and their designated healthcare proxy as to being able to end their life. I don't think that people should go on suffering for long periods of time without really being them, in essence. And I think that we should give people the choice to be able to do that.
How do you get over the emotion?
From family members?
Or from the general public that says, okay, you're saying that you're going to have state-sanctioned suicide.
Well, I mean, I think when you look at the sadness of having to see someone you knew that had so much life and energy sitting there in a hospital bed and really just...
No, I understand, because if I get to that point...
There's a lot of emotion behind that as well.
I don't want to torture my family. You know, if I've gone over and I know that bus ride, hopefully north, not south, is imminent, the last thing in the world I want is to put my family through it. But yet you get the emotion wound up, and I'm sorry, I don't want you making that decision for me.
Right.
So are you advocating that I get to make the decision of my life?
Correct.
Well, that's
a pretty crazy concept.
I was going to say, wait a minute, I'm missing something here. So I get to decide what's best for me and my family.
Yeah.
Okay, how do I argue that out? Okay, I was just trying to figure it out. Another hot issue around, sanctuary cities. Everybody that's come on the show I've asked, what the heck does that mean?
Well, I think that what that means is that there are certain cities that have decided that they're not going to do the federal government's job for them, and that they aren't going to commit local resources to rounding up undocumented immigrants.
Is that it? Because I guess I don't really want, you got somebody that came in, put their head down, working hard, being a good member, paying taxes, doing their thing. Leave them alone. Part that I don't understand is if I I break the law. I'm in Milford, and I break the law. The town's not going to tell the police that I'm here?
I think it's more that, we have a lot to deal with on the local level. It's more that if, ICE sends down a order to hold on to someone or detain them, that we're not going to commit our local resources to doing that.
I mean to go out and find them?
Not going to go out and find them.
Oh, okay, but
not going to.
If I find that you've murdered, raped, pillaged, whatever, and I arrest you, don't I get to tell the feds you're here?
Well, I mean, I think that really depends on what the local policy is. And I think that, you know, we wouldn't stop the FBI from coming in on a kidnapping case.
They've broken the law.
Right,
okay.
Right. I think that we have to give our local towns the leeway to decide, you know, how serious an issue is this on a case-by-case basis.
And I mean, our police chief, I really like. Tom is down to earth.
Absolutely.
And he has said, you know, immigration, first of all, I can't deport them to Rhode Island. You know, it's not like I can arrest, say, Tom, you're illegal. I'm going to make you live in Bellingham.
Yeah, right.
We don't have, even though many people, 28,000 of us, believe Milford's the center of the universe, there's 6 billion people out there that don't.
Right.
So I understand, number one, him saying, I can't do anything about it anyway. Number two, I need the local community, you know, the local immigrants to help me find out the bad people. And if I actually went out and rounded up people just because
you would have people that aren't reporting crimes.
Right.
That happen to themselves and others in the community. And when you have a police department that's forced to do that for the federal government, it really just ruins.
But is that what that's about then? The proactive rounding up of illegal immigrants?
Right.
See, that, I guess, we got so much other things to focus on.
Absolutely.
To me, is a different issue than...
We talked about so many other issues on this show.
Yeah.
One of them being the opioid crisis. When we have to commit local resources to round up, you know, people who, by every measure, are contributing members of this community, then we're really taking away from our ability to deal with other problems.
Yeah, I guess that's what I'm trying to figure out. I mean, if I arrest somebody for a crime, I guess I don't feel bad that I rat them out to the feds. If you're not...
Right, and I think there are avenues to kind of, it's really a case-by-case basis. You know, you don't want to force the police to be proactive in doing the federal government's job for them, but I don't think that it's denying the police from being able to communicate with, you know...
See, as long as that's the case, that if Tom, our chief, and his staff, in the normal course of action, arrest a bad person,
right,
then I have no sympathy about ratting them right out.
As you would with any other bad person, you know?
They're bad people.
There are bad people.
I mean, at the end of the day, I don't care if you're a citizen or an immigrant or an illegal immigrant. If you're doing bad things, I have no sympathy for you. You know, but we have so many people that are just down to earth, good people trying to do better for their family.
Absolutely. And if you don't want to hurt your community by, like you said before, ruining the relationship between the police and them.
When we look overall at the whole situation with DACA,
right?
How would you feel?
I mean, well, how I personally feel is that you have a lot of people who are Americans by any other name, who've been here from childhood, who've grown up here, who have worked here, and I just don't simply see how you can force them to go to some place they've never known. However, as a state senator, I would have no ability to impact that law at all whatsoever.
No, I was just curious because, you know, I laugh when people ask me, what's your heritage? Well, I'm Portuguese. Not really. My parents were Portuguese when they came to this country. Mm-hmm. If I went back to Portugal on anything but a vacation, I'd have no clue.
Right.
So, you know, again, if they've created problems by being criminals, okay, I have no sympathy. But these kids who essentially, except for the fact that, you know, at 1 year of their life or 2 years of their life weren't here, just seem like normal kids like everybody else in Milford High and everywhere else.
Absolutely, and they are.
we talk a lot about, well, gun control.
Right.
Your feelings?
Well, I believe in common sense regulations, you know, like not allowing people who have a history of domestic abuse to be able to own a firearm, I think is a pretty common sense regulation. And I say this also as someone who grew up with a father who was a police officer, lived around guns my entire life. And I believe in the right of someone to bear arms as well. But the
sensible right to bear arms?
The sensible right to bear arms, there needs to be a line. And I think there are areas we can look at in the terms of these regulations, like the fact that if someone goes through and gets their gun permit or license to carry in a state that has similar regulation to ours, I think we have to look at allowing that to transfer. You know, I think that's a reasonable place. I can talk to gun owners and see.
The part I don't understand is, okay, if I want to buy a gun,
right,
I have to go and get my FID card or be vetted 2-3 days ahead. What's wrong with that?
Nothing.
You know, I mean, I see this visceral reaction of, oh my God, no. Well, if I know I'm going to a gun show on Saturday, okay, so
then get yourself vetted.
That's it.
I mean, it's a matter of why do you need a gun that fast? And if you do, that worries me.
I'm more concerned that I need a gun in 2 hours.
Right.
I wonder why?
Yeah, I think that's a good question to ask.
You know,
and I think that, you know, that's a very common sense approach.
That's why I say sensible, because I'm not going to deny anybody's right to bear arms. We got that Constitution thing that gets in the way, you know. But if I don't behave with my car, you take away my driver's license. So like you said, if I'm a known user of guns for criminals, as a criminal, why should I be able to carry a gun?
Right. I mean, like you said, there's so many other areas where we take away people's ability to do things based on their behavior. And I think a gun is a very powerful tool, you know, so why wouldn't we give the government the ability to do this?
I have no problem saying I want you to, just like some of the other privileges that you have, I want you to do it sensibly. Right. Okay. You know, if I had to take a drug test, well, I did. When I got hired, I had to take a drug test. I didn't worry really about finding cocaine or heroin or meth or anything in my drug test because I had nothing to hide. If I want to go buy a gun and I have nothing to hide, why would I care if you check on me?
Right. Absolutely. And you know, we talk about things like bump stocks.
Yeah.
That whole situation where somebody, when you actually have an aftermarket part to turn your gun into a machine gun, essentially, or the ability to fire like a machine gun. And the real question is, why would someone who has any really legal purpose for that firearm need that aftermarket part? And it's things like this that we really need to look at. Well,
I mean, firing an AK is kind of cool.
Yeah, it's fun.
We'd go down to the gun range, you know, bring a cigar and act like silly old men and shoot off some rounds, and okay. I don't know that I need to shoot off automatic rounds and 50 at a time. You know, again, so it's just common sense.
Right.
Your first 30 days in office, what would they look like?
Well, I think that one particular issue, I think, to this region that we need to focus on is a loophole that was passed in 2014 that created this whole new kind of soil regulation. So there are these projects done with soil from many different brownfield construction sites that got put into this whole new category of soil reclamation. And this allowed soil from sites that might possibly be toxic to be dumped in various places in the district, dumped on top of aquifers even, in some of these towns. And I would look to close that loophole. That's a huge one for me. I think that there are several towns in this district where they don't know what's being dumped on top of their water supply, and I'd like to bring more light into that process and give the local towns more of a say into what's coming into their town. So that would probably be my first priority, is closing that loophole. I'd also look to try to reform Chapter 70 funding. I know that there's already a movement on the state level to do that, so I would join in with those efforts. And that should keep me pretty busy.
I was going to say, that's enough to start.
I think that should keep me pretty busy. So,
well, we're at the end of our show. Tom, I'm from Milford. Why should I vote for you?
Because I'm someone who understands the local issues, wants to go out and be an advocate for this district and talk to people who are dealing with these problems on the local level. Someone that wants to be a senator for the people and who actually cares about this district.
We thank you.
Thank you.
And as always, to our 6 loyal viewers, thank you for joining us. May tomorrow be a better night than tonight. And again, I won't ask you to vote for anybody, but I'll beg you, become educated, learn about your candidates, especially here in Milford. Are they around? Do they care about us? Will they represent us the way we want to be represented? It's an individual decision you have to make on your own, and you only do that by learning about the candidates. So good night, may God bless, and may tomorrow be a better night than tonight.
Not too long since I've been home.